Welcome. NSG 419, Study Section 3, Community Midwifery. Introduction. In this study section, you will explore how to assess and organize a community for health care. Community is where the people, the midwife, lives in their own environment and usually their own time. Community beliefs and practices influence health and decisions about health. Community midwives need to identify with the community in order to contribute to the improvement of health within the community. Learning outcomes. When you have studied this section, you should be able to examine primary health care, conduct community assessment, present how to organize primary health care and child health services. Review of primary health care. Primary health care (PHC) model of healthcare was adopted in the Declaration of the International Conference on PHC held in Alma Ata, 1978. In 1981, World Health Organization (WHO) officially endorsed the Declaration of Alma Ata and planned that to achieve the goal health for all by the year 2000, PHC will be implemented. Primary health care (PHC). The primary health care (PHC) has been defined as essential health care based on practical, scientifically sound, and socially acceptable method and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and the country can afford to maintain at every stage of their development, in the spirit of self-reliance and self-determination. Goal. The ultimate goal of PHC is better health for all. The goal will be achieved through 4 key elements. Key elements to achieving the goal. There should be political will to ensure fairness in the distribution of resources within a country. Community participation and involvement. Cooperative approach with other health sectors. The family and community should be the focal points. The basic principles for sustaining PHC: equitable distribution, community participation, health workforce development, use of appropriate technology, multi-sectional approach. Community assessment. Community analysis is a process of obtaining historical, demographic, economic, transportation, political, and cultural information about the community. A community assessment is basically a description of community and its people. The purpose is to identify the needs of a community in order to provide services appropriate to those needs. A community is a place where all the people and things that relate to human health reside. To form the picture of the barriers, motivators, and enablers that play in her choices, we must first understand the community in which she lives. The distance of barriers that separates women from care is the cause of maternal mortality. Midwives need to move into their client's community to learn how they may assist people. Without the community participation, the midwife's client base, Safe Motherhood initiative will not have impact on the current mortality ratio. Community assessment. Community assessment is basically a description of a community and its people. The purpose is to identify the needs of a community in order to provide services appropriate to their needs. This helps to identify the needs and set the objective for services, as well as identify needs that are beyond the capability of a clinic to resolve. This assessment includes population, number of women needing family planning services, other health facilities available within the community, availability of resources, materials, e.g., motorable roads, existing health facility staff, self-help projects, trained family planning providers, community activities that may interfere with client flow, aiming at high clinic census, location to clinic sites. Information can be obtained from community leaders, traditional leaders, women's group, reviewing of records and reports, health services reports, clinic or hospital records, and statistics. Peter Donner Alexander, 2001. Catchment areas or sites. Steps community assessment. Data collection does not need to be extensive, but should be adequate to identify needs and priorities in support of planning decisions. It should take into account some of the cultural, economic, and physical conditions. The midwife should ask herself why she wants to visit into the community. What is it she wants to know and achieve from the visit? Identifying the community may be one with the greatest problem. Learn as much as you can about the community. Determine the information already existing. Do review, assess, analyze existing information. Determine who in the community you want to approach to gain access. Plan the visit. Inform your host about the date. Make sure the date and time are convenient, and request that the people you wish to meet are informed of your visit. Use your interpersonal communication skills to get introduced to the people. Gain acceptance and trust by telling them their own needs and priorities. Use problem-solving steps to assist them in finding solutions. Plan ways of getting information from the community, which are survey questionnaires, focus group discussion, private interviews, observations checklists. Plan and carry out a community assessment. Focus on women's health, nutrition, their problems in pregnancy, and that of the children. Look at their needs and social factors such as needs, current local health practices, problems and their direct causes, particularly as this relates to women's health. Contributing factors that affect the well-being of pregnant women and children. What people feel is their biggest problem of needs. Level of knowledge on the topic. Need assessment. Advocacy. Financing. Identification and modification of sites. Equipping of sites. Establishment of local treatment protocols. Monitoring and evaluation of services. Assessment of needs for primary health care services. Gap analysis difference. Gap between the actual and ideal situation. Identify priorities and importance. Determine areas of importance and urgency. Identify the causes of performance problem and/or opportunities. Identify specific problem areas. Identify people's solution and growth opportunities. Interventions to improve performance. Method. Both formal and informal assessment method can be used. Formal method. Demographic data. Much of this data comes from census and statistical abstracts. Surveys. Key informant interview. These are interviews with members of the community with whom you have established trust. They might be respected members of the community or group that you are planning to work with. Workings. Meyers Visa, 2012. Focus group. Community functions meeting. In order to study a community, you must be part of the meeting. Informal method. Windshield survey. Drive around the community area you are researching and record your observation. Walk about. Walk around the community area you are planning to work with. Stop in a local restaurant. Walk-ins Mayors Visa 2012. Determination of the required resources. Human resources need an experienced nurse, midwife or doctor should organize and supervise programs. Train lay workers in appropriate skills and attitude and must be supervised. Show respect for the client's opinion and for the need for confidentiality. The provider may need to be one of the same sex and cultural background as the user and have strong communication skills. Coordination and cooperation among family planning providers within the country and NGOs to increase chances of sustainability ensures administrative, technical, and referral support. Skills that health providers should possess: technical competence, interpersonal skills, communication skills, administrative skills, materials needed. These include other resources other than human resources like instruments, furniture, lining, stationery, audio-visual aids, and commodities. Form for proper documentation like client record, daily, monthly, and annual summary or reports for monitoring. Budgeting is referred to as a comprehensive plan because all activities are considered when preparing it. Some elements of the budget are: it is a comprehensive and coordinated plan, it is expressed in financial terms, it is planned for the organization's operation and resources, it is future planned for a specified period. Types of budgeting: invisible money or budgetary allocation, visible money or cash. Organization of a primary health center or maternal and child health services. Primary health care, which is supposed to be the bedrock of the country's healthcare policy. The PHC aims at providing people of the world with the basic health services. The health services based on PHC include, among other things, education concerning prevailing health problems and the method of preventing and controlling them, promotion of food supply and proper nutrition, material and child care, including family planning, immunization against the major infectious diseases, prevention and control of locally endemic and epidemic diseases, and provision of essential drugs and supplies. Organization of a primary health care. The provision of health care at PHC level is largely the responsibility of local governments with the support of state ministries of health and within the overall national health policy. According to Abdulrahim, Olapipo, and Amadu 2012, most of the services rendered lack community linkage, and because of this, most community members are unaware of some available services. Department in typical health center, administrative block where patients register and all correspondence and services are managed, outpatient consultation rooms, inpatient wards. The wards are divided into male, female, and pediatric with newborn units, laboratory where diagnostic tests are done, pharmacy for dispensing of drugs, minor theatre for minor surgical operations like circumcision, stitching, manual and vacuum aspiration, maternity units, maternal and child health units, and kitchen and catering units. Important information: the staff should know their roles and execute them accordingly. Patients, even those visiting for the first time, should have clear direction where to go to see the doctor, to make an appointment, or to register. An appointment card should be given to each patient, stating the time of next appointment and indicating where and how to report. The principles for sustaining PHC are affordable and equitable health care. The 8 requirements defined by Alma-Ata report are maternal and child health, education, nutrition, potable water, immunization, community participation, provision of essential drugs, and management of common childhood ailments. Government health centers provide comprehensive child care, and the focus is preventing care and is headed by a clinical officer. The various cadres of staff, departments, and their roles were highlighted.